Hello, I'm Henry Smithson. I'm an academic general practitioner, and I'm delighted to be talking to Audrey Griffin today. Audrey is a remarkable young woman who is going through the journey of treatment for breast cancer. Audrey has volunteered to talk about her experience as a patient and also is hoping that she can help the next generation of health professionals, nurses, doctors, therapists, pharmacists, perhaps do things a little bit better and understand a little bit more about how she feels. So, Audrey, thank you very much indeed for talking to us.
You're very welcome.
The first question that I'd like to ask is talking about the word cancer. It's a pretty strong word. What do you understand by it?
Fear is the one word that comes to mind when I think of cancer. It's my second time having cancer. So I think first time I went into it, it was unknown. But now, second time round, it's more scary. It's the fear of death and fear of dying. And at my age, I was 31 when I was diagnosed the first time. It's hard. It's scary. For me, it's scary, and for me now, this time, hair loss is a big thing. When I do think of treatment ahead, first thing that comes to mind is my hair is going again, and it just takes a lot of your identity.
I see. So, essentially, are you losing yourself? Are you losing your identity? So, what sort of strategies will you employ this time if chemotherapy takes away your hair, and it may well? How will you try and maintain your identity through that period?
Well, I'm going to get a wig. I've decided for myself. I just feel it's a comfort thing to have that. I'm not brave enough right now to think about going around without the wig on. For me, I think it's going to be about my mental health. It's looking to the future, not thinking that this is going to take over my life. It's going to take over the next year. Treatment will be intense. I am guaranteed to lose my hair with the chemotherapy drugs that I'm getting. But I'm going to look to the future, look at a healthier lifestyle. You know, I'd like to get maybe my type of cancer is estrogen sensitive, which is in your fat cells. I would like to work on getting a weight down to a healthy weight that I can maintain, healthy diet, and I think that will really help me mentally, feeling that I'm doing all I can and taking control moving forward. Like on one occasion when I went in to the doctor, I was told, this isn't your fault. You can't do anything about it. But I nearly want to think there is something. I need to know there is something I can do about it, because if I don't have control, then I've nothing.
You talk about control, you talk about wanting to be able to do something so that you feel that you might be taking your life under control again, that it isn't something that has just happened and you can do nothing about. You talked about diet, you talked about lifestyle, losing some weight. How can future doctors and nurses and pharmacists, how can they help you feel more part of the process?
I think including you in the decision making would be big. Referring you to nutritionists, to counsellors. I've never been referred. I've always done that on my own accord. I've never been referred to anybody. And I think that when you're in it, it's all about the medical treatment. It's all about the chemotherapy, the surgery, going in for your checkups. It's checking your physical health. But the mental health is nearly the more important. To me, I believe it is more important, because when you're at home on your own in the evenings or up at 4 a.m. in the morning when you're not sleeping, tossing and turning, it's the fear that's keeping you up, and it's not the medical side of it.
Thank you. Audrey, tell me if you can remember, and I'm sure that you can, Tell me how the news of the first cancer, how it was broken to you, and what your feelings were at that time.
Well, I was brought into a room with with a surgeon and my breast care nurse, and the news was just broken. I happened to have a friend with me, and it was a lot of medical jargon. I sat on the seat, and she went through the results of the biopsy, the mammogram, the ultrasound. It was a lot of medical jargon. I wasn't really taking it in, but I heard positive cells. And she said it, she repeated it about 3 times, and I just leaned over and said, is it cancer? And she said, yes, it is. After that, everything just went out of my head. I felt a little faint. I wasn't really taking in what she was saying, and that was tough. But it was medical jargon. I understood a lot of it, but another person would really struggle with that. It's scary. They don't understand what's being told to them, and it's hard enough when they're just about to give that news. I think to give it in layman's terms, so to speak, would be so much better and so much easier for a person going through that.
I have a question, a difficult question to answer perhaps. So you say that your surgeon, on giving you the diagnosis, giving you the results of the biopsy and all the other tests, talking about positive cells, the surgeon did not use the word cancer.
No.
Until you asked her if indeed it was cancer.
Yes.
Do you feel that the surgeon was a little bit uncomfortable when you asked that question?
I would think so. I think I think she would have been. It's a hard thing to tell anybody they've cancer at any age, but I feel at my age it is tough at every age, but
Yes.
I felt it more. I think it must be hard to give that information, but you need, at the same time, you need to be out straight and honest with a person. I remember just where my mind went. I heard the word mastectomy, and straight away I thought, oh, it's spreading, it's everywhere, it must be in my lymph nodes, it's everywhere. And that was the first thing I said, is it spreading? Why are you taking everything? And she just said, it's because of your age, we're not taking any chances, we'll just remove it all for your safety. But it's that time, you can't take in the information 5 minutes after you've been told you've cancer. You need to go home, process it for a few days, and then go in. Then it would be nice to see them again to go through it further.
Thank you. Did you get the opportunity to talk to them again a few days after you had the diagnosis, when you'd kind of processed some of the information in your mind?
Not my surgeon, but my breast care nurse.
Okay.
And my breast care nurse was fantastic. She was on holidays the previous week after my diagnosis, and she rang me from her holidays to check up on me and see how I was doing. She was amazing. She was available all the time if I wanted to speak to her.
Okay. I'm delighted that you had such excellent support. What attributes, what skills did the breast care nurse have that perhaps the surgeon didn't?
She spoke to me without the medical jargon, more on how was I feeling, my fears, my concerns, and which is what you need to deal with at that point. It's the fear of the unknown. A first-time diagnosis of cancer is the scariest thing you'll ever have to go through. Well, it's the scariest thing I've had to go through. And she just spoke to me as a person. And she knew she's dealing with people every day of the week with breast cancer diagnosis. She knows what's coming. Like one day, one thing won't be a fear, but then the next day it'll take over your mind. So she was great like that, with the practical stuff as well. Everything, all the practical pre-surgery, giving me all the information I needed. She was brilliant.
So, you'd been to the hospital. You'd had the diagnosis of cancer. Did you suspect that may be the diagnosis that you were going to meet when you went to the hospital?
I did. I knew what was coming, I thought. I went for my mammogram, and they took quite a few x-rays, which had me thinking, Then I was told I was going for an ultrasound, and I could see them ticking, and I knew they were measuring something. But it was the way that the, the doctor that was doing the ultrasound, my mammogram hadn't come through from the other imagery department, and she was speaking to a nurse, and she was quite anxious to get it. And from that alone, I knew she wants to see it for a reason. If there was a sense of urgency about it, she said, I need that right away. And I was watching it. I could see it playing out, and I knew there was something coming. And then when the biopsies were being taken, I know biopsies can be benign as well as malignant, but my gut, from what I was seeing around me, I knew there was bad news coming.
And when the investigations were being undertaken, the mammogram, the ultrasound, and the biopsy, did anybody give you an indication of what the possible diagnosis was? Or did everybody say, no, we don't have the results?
No, everybody said, we can't, we don't know the results.
Was that helpful to you, or do you think it could be done differently?
I do think it could be done differently. I think to even give somebody some indication that there could be bad news coming, I think it would really help. That week of not knowing is tougher than any week after you find out. You have 7 days of sleepless nights, wondering, anticipating. I do believe they can tell a lot from what they're seeing. I do think if they could indicate something, it's preparing you for the biggest blow you're ever going to get.
So you went home that first night after getting the diagnosis. What was going through your mind in the middle of the night?
Death.
That you thought it might kill you very soon?
Yes. I knew it wasn't imminent, but down the line. I suppose I didn't have close people who had breast cancer before. The couple of people I did know, unfortunately, it had gone too far, and they did die from breast cancer. So I was thinking of them, and that was harrowing, and that was scary in the middle of the night.
That diagnosis, of course, puts enormous pressure on people's emotional state. Obviously. Were there any times, again, I guess it's because you weren't sleeping that week, were there any times in the middle of the night where you thought, this is going to kill me, life is not worth living, I wonder if I can go on?
No, I didn't. I never had those thoughts. The first time around, I was very positive, even from when I got my news. I always just focused on the positives. I never really, of course, you think death, you think cancer. But when I spoke to my nurse, she outlined there was no lymph node involvement, you caught it quite early, it hasn't travelled, and I focused on that. I didn't focus on...
Yes.
I didn't get really depressed. Of course, I was depressed, but I didn't sink to hopeless feelings or giving up. I never did.
So, for our students in their early professional lives, when they come across somebody with a recent diagnosis of cancer, how could they help people work through to try and find the positives? Because it's remarkable if somebody can find a positive when you've had probably the worst diagnosis that you can get. Is there anything that we should be teaching our students about how to approach people, how to deal with people, to support people, or is it something that comes very much from inside of you?
I think support of other people, survivors, is hugely important. I was never put in touch with people who had come out the other side and were doing well and back to normal life. I have myself spoken to people as a survivor, but I didn't have that. Now, I didn't ask for it, but it wasn't offered to me either. But I think it's huge when you're facing all this fear to see somebody who's come out the other side, a few years down the line, life is back to normal, and cancers in the past. As the years go on, you think less and less about it. And just to have somebody to focus on as your role model, really, I think that would be hugely beneficial.
So some of the programs for cancer survivorship, for self-help support groups, perhaps should be more actively encouraged in
Yes.
different parts of the world.
From day one. I do believe from
early on.
early on. I think that's when you might need it, is when you have questions that you can speak to somebody who's been through it. They know what's coming. You know, they know what to say, the right things to say too.
Yep.
That will give you that motivation and positivity to drive you through the treatments and everything else that's coming. I think that would be great.
That is really interesting, and thank you. That first appointment where you got the diagnosis, you then had to go home.
Mm-hmm.
How did you tell your family?
That was the hardest. That was the hardest thing I've ever had to do. Sorry. I suppose for me, your parents, you're always their child no matter what age you are. And that day I went home.
Oh, yes, you will be forever.
Forever. But that day I had to go home, and my friend brought me down in the car, and I said, this is going to be, they're never going to relax for the rest of their lives. They're going to worry about me in a way they should never have to. And I broke it to them. I stayed positive throughout. I didn't shed a tear. I didn't shed a tear all that day. I was going around like I was told I was getting a toenail removed. It wasn't sinking in properly. My mind was racing, but I sat down and I just tried to ground myself before they came in, and I told them, and from the offset they were fantastic. You'll be fine, you're tough out, you'll get through this, there'll be no fear of you. And I kept that up with them always. I was always very positive around them. But that is the toughest, is telling your family, because you know they can't do anything for you. They can support you, but this is your struggle. You have to deal with the mental side of it, the physical side of it. They can't help you on your journey in that sense. So they feel, I suppose, they just can't help you out in that.
Yes.
And that's hard.
Did you give them some indication that you were expecting bad news before you went
No.
to the clinic?
No.
You were keeping that absolutely to yourself.
I shared it with friends, but I didn't tell my family.
Yeah.
I didn't want to worry them unnecessarily.
Okay. Now, Audrey, if I had been fortunate enough to be your GP at that time, what could I, as a general practitioner, have done to help your family or to help you? Or would it have been intrusive if I'd rung you up or if I'd invited you in for a consultation? Is there anything that we can do, or is it something that is much better left to the individual, knowing, of course, that you are a very able individual?
I think I would be nervous about a GP saying something to my parents that would worry them. Like, my prognosis was good, and I was able to give them all the positives to keep them positive. But my fear would be somebody saying something that would worry them. I know on one occasion I spoke to my surgeon or my oncologist, and he was very positive. He said the type I had was great. It was estrogen, progesterone positive, HER2 negative, no lymph node involvement, caught very early. I was saying yes, 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 yes. And as I got up to walk and turned around, he said, but because of your younger age, there's a bigger chance it'll come back again. And that's all I took out the door. So you really have to be so careful what you tell a person, because they're watching your face, they're listening to your language. You're so sensitive to everything that's been told to you. And out of all the positives he gave me, that was the one thing I took out the door.
Yes.
Yeah.
If we may talk about the second diagnosis, the diagnosis that you're about to have treatment for. How did you find out about the a second cancer?
My annual mammogram. Yeah, I had my annual mammogram 2 months ago, and on that day I was watching the radiographer, and I was kind of asking, how's it looking? She was like, oh, the results will go to your doctor. And I said, look, you can give me an idea. But she'd only taken one x-ray, and she sent me on my way and said, have a great weekend. So I went out the door thinking, this is good. I was very positive. I could tell she was positive too about it. But it was the following week I got a call from my nurse saying that something had been spotted, something very small had been spotted, and that she'd like me to come up for biopsies and ultrasounds. Now, she did tell me that because she knows I get anxious and I want to know what's happening right now, I don't like waiting, she said, come up today, we'll do them. So in my head I was saying, am I being paranoid now? Is she only saying that to get me up straight away? Or is she genuinely bringing me in early because she knows I'm not great for waiting? And that's when I knew things were going badly again. But initially I had went home on the Thursday thinking everything was fine.
How did that feel when you were told that they wanted to do a biopsy and an ultrasound when you thought that things were okay?
I'm sick. I was sick to the pit of my stomach. I just knew my gut was telling me what was coming, and my nurse is amazing and she'll always be positive with me, but I knew from what the way they were when they were doing the ultrasound and taking biopsies, and I said, please give me an indication, can you give me any idea? And they weren't budging. There was no way I was being told anything.
And your nurse this time, is it the same nurse that was looking after?
Yeah, she's my nurse throughout.
So you've known the same nurse for the last 5 or 6 years?
Yes.
Has that been a benefit?
Definitely. I think it has. She knows me. She knows all about me. I tend to get onto her if there's anything I feel or sense is wrong. I'm straight on the phone to her. She knows my personality and she knows what way to deal with me. She has been fantastic throughout, and even out of hours.
Yes.
If she's contactable all the time. I've 2 nurses, because if she we'll say, be on holidays, I had a second nurse and I would be as close. I know them both. I would be as comfortable with both of them.
Excellent. And of course, we wish you every good wish for your treatment this time. Can I ask a difficult question?
Yes.
Sometimes when doctors or nurses or other health professionals are talking to people about an illness, we try very hard to use the right language. We try very hard to say the right thing. And I hope that more often than not we manage to get it right. But do you have any experience of people somehow saying the wrong thing completely by accident?
I was going for my annual mammogram. I think it was 3 years after my first diagnosis, and initially they bring you in for a physical exam before you go for the mammogram. And the doctor that did my physical felt something and said, oh, I feel a lump, this isn't good, send her for a mammogram right away. And there and then I nearly fainted on the table. He wasn't, I didn't find him very empathetic. He wasn't looking at me. He didn't even look at my face. He was just looking at the lump, spoke to the nurse, this isn't good, send her for this. And that was scary. Thankfully, it turned out to be nothing, but that stuck with me. I found that hard.
So you felt that you were a bit of flesh on a table, and he was talking to somebody else about this specimen, please do something else.
Exactly, yes.
And he had great difficulty in looking at you and talking to you as a person.
He did. And he pushed and prodded, and it hurt. Now, I started to cry, but it wasn't the pain, it was the fear when he was pushing, and he didn't acknowledge me as a person. He didn't ask me, was I okay? The nurse came up to my side and caught my hand and squeezed my hand and looked at me, and I knew she was saying, you'll be okay. But he didn't acknowledge me or my upset at all. There's one more thing I found this particular time when I went for my surgery. The following morning, when the consultant comes around with the junior doctors, I remember there was 5 of them, all males this particular day. They came into my room. I had my own room, and the consultant stood at the door, and the 5 of them literally gathered around the bed. Now, I was still a bit out of it. I hadn't had a great sleep, and they came in and said, with their chart, hello, Audrey, could we have a look at your wound, please? Just like that. And firstly, no one pulled the curtain. And secondly, there was 5 of them. Now, I was comfortable with my scar. I had seen it the night previous. But I know for a lot of people, they can't look at it for weeks. They just can't face that physical side of it. It's upsetting. And I felt they didn't think about that, how this would be for me. There was 5, happened to be 5 males, which is a little more intimidating, standing around waiting for me to lift my gown so they could look at my scar. And it just wasn't very personal. And nobody asked my permission, would you mind? It was, well, they did say, could you lift this and show me? But I don't think they were thinking about how it would feel for me. I was vulnerable. I had just had surgery the day before, and it was a scar that was reminding me of everything that had happened and what was coming. And I felt that could have been dealt with better. The consultant did say, are you going to pull the curtain? Are you going to give her some privacy? And I know they're training, but I certainly think the way they march into your room, you could be asleep there. It could just be a little more personal, I feel.
So when students or junior doctors examine you, you say that it could be more personal. If you were teaching them, and in a way this video is teaching them, what advice would you give them for the next patient that they see with that problem?
Firstly, I wouldn't come in the door and all stand around the bed looking down on top of you. I think to just come in, if one person sat down, said who they were, introduced themselves, asked you how you slept, how are you feeling today, how are things, and approached it just in a more kind manner. I felt on this particular day they were more concerned with what the consultant was, what they were being watched and they were being examined, they're in training, but they were more concerned with that than me in the bed.
That's interesting. So, and you say that they didn't really ask permission.
No.
How should they have asked? And I absolutely agree that we should always ask permission of the human race when we are thinking of examining or investigating. How would you suggest a student would ask permission after they've introduced themselves, treated you as a human, as a person? So it's person-to-person connection.
Yeah.
What sort of words, what sort of phrases, how would they ask permission?
Well, I think even by starting to say, have you seen your scar yet? This is the morning post-surgery. Have you seen it? How are you feeling about it? Are you okay for us to look at it? Have you looked at it yourself? Do you mind us looking? There's 5 of them. Would you prefer if it was just one? Something like that would be easier.
Yes.
Like, again, for me, I'm a bit tougher, and I was okay with it, but I couldn't but think of another person who might be very bothered and very upset by that.
And in a way, I suspect that it's still been an uncomfortable episode for you.
Yeah.
However, you were able to deal with it, but it's something that you would prefer not to go through again.
No.
Okay. We often find that when people go for tests in hospital, whether it's a swab for a sore throat or whether it is a mammogram in case it's a cancer of the breast, that the investigators never give a possible answer to what the tests are showing, even though we kind of suspect that they've got a bit of a hunch. And you very clearly explained that your experience was that they wouldn't tell you a thing. By them not saying anything, did that reassure you?
No.
If we were to be able to change the world, how else do you think investigators, medical investigators, could communicate better with the individual who is being assessed?
I do believe that by giving an indication of what's to come, when in circumstances where they know, where it's looking clear what it is, to give an indication. I know it can't be 100% until results are back, would be beneficial, because you have that week usually, or I'm sure it varies, but at least a week for results of biopsies and for the biopsies. And I think that week is so tough. It's the toughest week, and to have time to let it sink in, even if it's only a little bit, it will still help when the blow comes on the day your results are given.
Thank you. When you saw your oncologist, he was giving you a lot of positive information the first time round, and then one piece of information which felt negative. It was the negative that you remember. Second time around, seeing your oncologist, what if your oncologist said, okay, Audrey, we know that the chances of survival are so many percent. We know that the chances are this or that or the other. We have a risk table. We can tell you what the likely risk is. Would you find that helpful, or would you prefer not to know until you've been through the treatment?
Not initially. Personally, I feel you're very vulnerable at the start. A second diagnosis, it knocks you much harder than the first. And I don't think statistics for me would be of any benefit. At the end of the day, everybody's different, and how you approach lifestyle changes and all of that, I think, can make a difference. And for that reason, I think statistics, they're dangerous. They're for your mental health. I don't think they will help, because your instinct is to go with them, and that's what you hold on to, and that's not what is going. That's not going to keep you positive. So I don't think, for me personally, they would be beneficial at this point.
So are you telling me that at 3 o'clock in the morning, when you wake up and you've got your laptop, you don't go on the web and sort of try and work things out?
No, I don't. I was told, day one, my nurse told me, don't Google, and I haven't. I sometimes get friends to Google, and if there's something that's worth knowing, they can tell me, but I don't. I don't Google. It's too dangerous. I think Googling would have you dead in the grave. Realistically, it's not.
That's
it's
interesting.
not helpful.
Thank you. Audrey, really, the last question. You've had a lot of experience of good and perhaps less good interactions with various people in the health professions. Can you summarize the good qualities, the things that make professionals more effective or more human? How would you summarize the qualities that we should ask our students to embrace?
I think kindness and looking at a patient as a person and not as a diagnosis is majorly important. I think looking at a person's mental health is paramount when treating somebody. I really think to look at what they will need when they're outside of the hospital in the early hours of the morning when you're awake. Somebody who can speak to you like a professional counsellor to delve into these issues and, work them out and deal with them would be great, would be very beneficial. I think to have control is the most important thing. And if they give you control by giving you a nutritionist, just what every individual is different. But for me personally, I think nutrition now and that side of things will help. So a doctor that's in tune, or a nurse that's in tune with what you can do to take control yourself. I feel I go along with the medical, with what I'm told. When my oncologist says this is what we're doing, I don't question it. I trust him and I have every faith in him. But for mental health, I think they could really look at giving you some support, more support in that aspect. I also think, I know with the staff, they really try to keep you positive. Well, like I speak of the nurses now, but maybe in some cases, not to give hope. I'm trying to say, like, don't give false hope on something either. Like, I have had one or two encounters where I was told, well, this looks like it could be negative, or this is looking good, and then I've been knocked back because it hasn't been the case. So there's a fine line there between giving a little bit to break the news, but also not giving false hope that things will be okay, possibly because the person you're dealing with, the professional, is uncomfortable with breaking the news. If you understand what I mean.
I do, thank you. Can I look ahead just for a year or two or three?
Mm-hmm.
So, we hope and we anticipate that the treatment this time is going to be satisfactory and successful. But you will be on tablets.
Mm-hmm. Hormone therapy.
Hormone therapy. And they work best if you take them as prescribed.
Yes.
There is something called medicine's adherence. In other words, do you take the tablets as they are prescribed? Taking tablets on a regular basis, a year or two down the line, how does that make you feel?
I suppose the side effects of a lot of the hormone therapy aren't great. I was lucky the first time around. I didn't have many negative side effects, but for some people I know they struggle a lot with them. I don't mind taking the medication because I know it's helping me. I was on a drug called tamoxifen, and unfortunately, even whilst on it, I still grew a second cancer, so it wasn't working for me. So I will not be going back on that one, but I'll be starting a new hormone therapy. But I suppose psychologically, knowing that I'm taking this tablet, it's helping me, it's okay with me. I don't mind that.
So that tablet doesn't keep reminding you that you're at risk of cancer. That tablet would be seen as being
Preventative.
an agent to prevent anything happening in the future.
Yes, that's the way I look at it personally.
Yes.
Yes.
Yes. Audrey, thank you very much indeed for your time and for your honesty. It's been
Thank you.
very, very interesting and most helpful.
Thank you.